Hello everyone. Today, we'll be discussing a medication called Ritalin, which is a widely recognized brand name for the drug methylphenidate. As with all our talks, this session is designed for educational purposes. If you have health-related inquiries or worries, it's essential to consult a medical professional. Description: Ritalin, whose generic name is methylphenidate, is a central nervous system stimulant. It affects chemicals in the brain and nerves that contribute to hyperactivity and impulse control. Ritalin is primarily used to treat attention deficit disorder, ADD, attention deficit hyperactivity disorder, ADHD, and narcolepsy. When used in conjunction with therapeutic strategies, Ritalin can help enhance attention and reduce impulsive behaviors. Warnings: Ritalin should not be used if you have taken an MAO inhibitor in the past 14 days, as a dangerous interaction could occur. It's also crucial to remember that Ritalin is a drug of abuse, and you should be observant if anyone is using your medicine improperly or without a prescription. Before taking this medicine, several factors should be taken into account before starting Ritalin. You should not use Ritalin if you're allergic to methylphenidate or if you have glaucoma, a history of tics, muscle twitches, or Tourette's syndrome, severe anxiety, tension, or agitation. Additionally, inform your doctor if you have a history of heart problems or heart defects, high blood pressure, a family history of sudden death or ventricular arrhythmia, a history of mental illness, depression, suicidal thoughts or actions, a history of circulation problems in fingers or toes. It's also vital to tell your healthcare provider if you're pregnant, planning a pregnancy, or breastfeeding. If you have a surgery scheduled, let your doctor know, as you might need to stop taking Ritalin temporarily. Side effects: like all medications, Ritalin has potential side effects. Some of the more common side effects include nervousness, increased heart rate, increased blood pressure, sleep problems, sweating, loss of appetite, weight loss, nausea. Serious side effects might include circulation problems, with symptoms like fingers or toes turning white, blue, purple, or yellow, mental/mood changes, example, agitation, aggression, mood swings, depression, hallucinations, suicidal thoughts, and uncontrolled vocal outbursts or tics. It's essential to be vigilant about these side effects and immediately consult your doctor if you notice any unusual or severe symptoms. Interactions: Ritalin can interact with other medications. Therefore, it's paramount to inform your doctor about all the drugs and supplements you're currently taking. Dosage: the correct dosage is crucial for Ritalin's effectiveness. It's typically taken 2 or 3 times daily, preferably 30 to 45 minutes before meals. However, the exact dosage and timing will depend on the condition being treated and the patient's response. It's imperative to follow your doctor's instructions closely and never alter your dosage without their advice. Avoid: when on Ritalin, it's advisable to avoid alcohol as it can increase the risk of side effects. It's also wise to be cautious when driving or doing anything that requires alertness until you know how Ritalin affects you. FAQ: a common question regarding Ritalin is about its potential for addiction. It's important to understand that Ritalin has a potential for abuse and addiction, especially in teenagers and young adults. Therefore, it should be used exactly as prescribed, and you should be mindful of any signs of misuse. Closing: that concludes our overview of Ritalin. Please remember that the information provided is meant to educate and should never replace expert medical guidance. Always consult with a healthcare expert about any questions or issues. Thanks for joining us.